before I'm starting my presentation, I just want to ask, like, what is the background of the audience, so that accordingly I'll make my discussion over there.
Most of them are MPhil scholars in psychiatric social work.
Right.
Very few, one or two are already passed out people.
Okay. Okay, fine. So basically today we are discussing what is psychotherapy. There are various terms basically we use in day-to-day life. For example, we talk about counseling, we talk about guidance, we talk about psychotherapy. And still there is a not clear-cut distinction between these three particular issues. And most of the time the student get confused, like whether counseling and guidance is same, or guidance and counseling is same, or psychotherapy is equivalent to counseling and guidance. So here we will discuss what is psychotherapy exactly, right? So for example, if we talk about a human being is a social creature. We used to discuss this particular phrase, and it has own biological and psychological issues. In these biological and psychological issues, when talk about human being, they have their own particular needs. And according to their needs, they want to fulfill that need. And if there is any hurdle in that particular issue, for example, if we talk about biological issues, then he or she tries to fulfill that need through biological perspective. But if we say there is a issues in psychological problems or well-being, then we discuss about the same perspective where he or she can fulfill his or her psychological well-being. So psychotherapy per se is a domain of psychological well-being when we are talking about improvement of the psychological function. There are different terms basically used in psychotherapy, and consolidate if we discuss what is psychotherapy means definition wise, very famous definition given by Wilber in 1967. And interestingly, that is very interesting phenomenon. Like after 1967, there is no other definition came into existence. It means that definition is including everything. Like there must be some emotional problem. One, we want to improve that emotional issues of a human being. Either we want to remove it, or we want to modify it, or we want to retard it that existence. So there is three particular domain of psychotherapy. One is to remove any psychological issue which you want to rectify. The second thing is we want to improve that mediating disturbing pattern in that particular behavior. One is we are talking about symptoms. One is we are talking about maintenance factor. Like we are using this in day-to-day life. Like for example, predisposing factor, precipitating factor, maintenance factor, perpetuating factor. These factors we are discussing. In the same line, psychotherapy is basically discussing on same particular domain, but it gives an interesting domain that is known as promoting positive personal growth or development. So two things is basically related with illness. Either we want to remove the symptom, we want to modify the symptom, or we want to change that circle through that these symptoms are existing. That we will discuss what this mean by mediating disturbed pattern of behavior. So two things is basically we want to improve the symptom, and third majorly, if we want to improve some personality issues. For example, every time patient won't come to you. Every time we are not saying psychotherapy is only for the patient. No, psychotherapy is sometimes important for the client. The word is different from patient and client. So in psychotherapy per se, every time we never use some patient, right? So client means he doesn't have any problem. He's maintaining well. He's adjusting very well. But after this, smoothing functioning or soothing functioning, he want to improve some of the personality issues. For example, some child comes to you and he or she will say, everything is fine, but I want to improve my self-confidence. Everything is okay, but how to deal with the problematic situation, I don't know. Everything is fine, but how to cope with the problematic situation, I don't know. These three basic issues which I have discussed later, that is basically we want to improve his personality growth and development, right? Now, before we are going towards psychotherapy per se, what is the psychotherapy, what is the term and conditions for that, what is mode of psychotherapy, in which condition we can give psychotherapy, the interesting phenomena which we want to discuss, the essence of a good psychotherapist. That is very important phenomena. Psychotherapy doesn't mean this is a mechanical issue like medication or pharmacological treatment, right? Psychotherapy is something different, and the main essence would be on psychotherapist. And then psychotherapist, when we are calling it, he should have some different perspective of personality. For example, we talk about empathy. This term we used to use in day-to-day life. Empathetic relationship or empathetic means what? Whatever you want to feel in the other shoes. He or she is in a suffering condition, or he or she is in happiness condition. You are exactly feeling that particular issue. Then it's calling empathy. Because psychotherapy, when the patient comes to you, if you want to show any empathy to him, we don't want to sympathize the patient. Okay, you have this problem. Oh my God, that is sympathetic behavior. But if we want to empathetically control, giving that relationship to the patient, then psychotherapy can become a essential aspect and can give some improvement in the patient. The second important aspect that is known as unconditional positive regard. There is two type of positive regard. One is conditional, another is unconditional positive regard. For example, whatsoever condition is there, but there is reaction, there is condition, there is uniqueness of the individuality that should be remain same. Every time, if for example, if I feel like my colleagues will be happy if I'll do my particular behavior in that particular way, right? There are so many personality you will see in your surrounding. For example, if we talk about anxious personality disorder, or we are saying if somebody is very anxiety prone, his personality is something different. And if you see somebody is having very healthy personality, so that healthy personality sometimes lead or sometimes controlled by his own particular behavior. So unconditional positive regard is very important. Few scientists are saying if some child, in the developmental phase or growth phase, he has unconditional positive regard. For example, whatever he wants to do, he is doing according to his own wish. He don't want to make happy to others, right? If somebody will feel sad, I will not do this particular task. If somebody will feel very happy, I should do particular task in respect to, or when he is giving more importance to other perspective. So that is unconditional positive regard should be there in essence to a psychotherapist. Then very important, genuineness. Like whatever important issues are there, we are giving any, very, very genuine issues about that particular issue. So empathy, unconditional positive regard, genuineness, flexibility, objectivity, and sensitivity. These are the 6 basic characteristics is very important when we talk about the essence of good psychotherapy. Right? As I told you, the successful of a psychotherapy is depend on more or less therapist plus technique. So there is two different pillars. Every time we can't say only technique will give a result. No. Sometimes technique maybe it is not very useful, or maybe not particularly practically applicable to any disorder. But when we talk about these characteristics, when we talk about therapist perspective, this can be very healthy. Let me give one example. For example, in a day-to-day life, you are seeing some clients, and you are not giving any psychotherapy per se, professional relationship with the patient or client, and we are not establishing any formal psychotherapy. But if we sit with a client or patient and we are discussing day-to-day life issues, whatever he or she is having, and after discussion of that particular point, he or she is feeling good, he or she is feeling very comfortable, it means that talk, that is very important. That talk means all the conditions which we have discussed is there in psychotherapy. That's why the person who is in a problem or who has suffered is feeling good, right? So these are the two different domains which is very, very important. Now, more or less, if we talk about types of psychotherapy, we discussed what definition of psychotherapy. Now we are talking about types of psychotherapy. There are 3 basic types of psychotherapy, and we use this psychotherapy in day-to-day life. If you will go in a psychiatric setup, trainee, PSW trainee, or clinical psychology trainee, this term psychotherapy or sportive psychotherapy we used to use in day-to-day life. Whenever patient is going to be discharged, whenever patient is admitting to a hospital, every time we use this term, we are giving sportive psychotherapy to the patient. So this sportive psychotherapy is day-to-day life in very frequently we are using. The another term is re-educative psychotherapy. The term itself is giving meaning. Re-educative therapy means something was there and we want to re-educate that particular domain. Re-educative psychotherapy. The third would be reconstructive psychotherapy. Reconstruction means what? Construction means we want to make something new. Reconstruction means whatever personality is there, whatever domains are there, whatever variables are there, personal variables, we want to reconstruct that personality factor. So it means that three domains are very important. Like if you will see the depth of this psychotherapy, sportive means shallow depth. We just want to see there are three basic issues: ego, superego. We want to maintain that boundary, sportive psychotherapy. But if there is any deep issues, for example, a bit deep issue, we want to maybe rectify with re-educative psychotherapy. But in some issues, that deep issue will be more deeper than reconstructive psychotherapy can be worked. Now we will discuss how this differentiate, on which terms and conditions these three therapies are different. Like sportive psychotherapy means what? For example, you are giving counseling and guidance. That will maybe comes in the category of sportive psychotherapy. For example, you are in a bus, somebody is with you only, and he or she is feeling upset or problematic issues, and you are simply giving counseling and guidance to that particular, individual. It means that sportive issues means you are guiding for something, you are giving counseling for something. Maybe environmental manipulation can be one aspect. Maybe some reassurance, persuasion, emotional catharsis can work out in this particular domain. So these are the sportive psychotherapy which basically maintain the boundaries of id, ego, and superego, and try to make equilibrium in these three domains, right? So sportive psychotherapy, as I discussed, basically, or we are using in day-to-day life, or when we are saying counseling and guidance, that can be approaches of sportive psychotherapy. The second, re-educative psychotherapy, is basically readjustment of our effort, right? Maybe you have heard this term: behavioral psychotherapy, relationship psychotherapy, counseling psychotherapy, marital psychotherapy. These basically comes in a category of re-education psychotherapy. Re-education means we want to re-educate. Everything is based on the learning principle. Behavioral therapy is saying there is nothing which is come out from the biological perspective. Behavioral therapy is saying everything is based on your learning. Like for example, if we differentiate this re-educative and reconstructive psychotherapy, reconstructive psychotherapy is saying everything is based on your childhood rearing practices, or everything is based on your personality. But behavioral therapy is saying everything is based on your learning. Different proponents came into existence. For example, this classical conditioning came by Pavlov. Then Skinner has given operant conditioning. They all conditioning are saying discuss about the re-education of psychotherapy. They are saying, you just in example, they are saying when we discuss this, learning is based on this problem is based on learning. So their perspective, whatever you want to make any child on the basis of learning, you can make that child. That is a core component of behavior therapy. It means whatever you want to teach, you give that child of 3 year or 4 year or 5 year, and you want to make that child judge, IPS, IAS, whatever you want to make that child. Behavior therapy is saying we can make. Behavior therapy is saying normal and abnormal behavior we used to learn. So this is a re-educative psychotherapy. So its main goal is to modification of that particular behavior, right? The third very important, which we used to use before that reconstructive psychotherapy, there are few conditions. Like as we said, sportive psychotherapy is not as such professional relationship. But in re-educative psychotherapy, which patients are suitable for that particular condition? Like this question will come or arise in your mind. Like, sir, which patient is suitable for sportive psychotherapy? Which patient is suitable for re-educative psychotherapy? Which patient is suitable for reconstructive psychotherapy? There are few conditions which is very important for re-educative psychotherapy. He should have fairly good ego strength. It means his rational thinking should be very important. He should know what is wrong, what is right. It means neurotic spectrum disorder is very suitable for behavioral psychotherapy. There should not be any personality problem. If that person comes to you and he has personality issues in a severe form, for example, cluster A, cluster B, and cluster C, he won't be suitable for psychotherapy, re-educative psychotherapy. But yes, if we talk about trait level, yes, that is suitable for that particular psychotherapy. If somebody is having educational issues, marital issues, interpersonal issues, and social adjustment problem, it can be very useful. But when we talk about reconstructive psychotherapy, Let me discuss in historical aspect. When psychotherapy came into existence, any psychotherapy, first psychotherapy came as Freud psychotherapy or Freudian psychoanalysis technique or Freudian psychoanalytical technique. There are few terms which we used to use interchangeably. First technique came by Freud only. That's why we are saying father of psychology is Freud only, right? So first phenomena is given by Freud, which is related with three major concepts: consciousness, subconsciousness, unconsciousness. Or in other part, id, ego, and superego. There are different techniques came into existence. Whosoever supported Freud, they will become Freudian theory. For example, Kleinian analysis, object relationship, Adler and Jung psychotherapy, Sullivan psychotherapy, psychoanalytical oriented psychotherapy, transactional approaches. So these were the favor or they were following that stepping stone of Freud. That's why they are using that term psychoanalytical psychotherapy. There is different phenomena as re-educative psychotherapy. As I told you, re-educative is saying whatever you want to make any child, you just give to us, we will give any type of learning and he will become. But Freudian is saying, or reconstructive psychotherapy is saying, no, it is not always true. Everything is not upon the learning. This is basically depend on your unconscious material. That is based on your personality, whatever you have developed. If fixation is in oral stage, your personality will be different. If your fixation is in anal stage, personality would be different. If fixation is in phallic stage, personality will be different. It means everything is based on your development. So that is Freudian theory or therapy, which is saying if you want to reconstruct that personality, the patient would be okay. Here, there is some different patient suitability. For example, re-educative psychotherapy we have discussed. So here the suitability will be very different. The major suitability, if you will try to understand, there is a mnemonics, YAVIS, Y A V I S, YAVIS. That is given by Freud. What YAVIS means? Freud is saying wherever we are using any methods of psychoanalytical technique or psychoanalysis, the patient should be young, he should be intelligent, he should be social, he should be verbal, right? So these category or these cluster should be there in a patient where reconstructive psychotherapy can work, right? The another aspect, as I told you, the maximum issues is related to unconscious material or past relationship with the parent, which is part of subconscious or unconscious mind. That is very important in reconstructive psychotherapy. Then another is repression is the defense. Everybody is using a defense mechanism. If you will say dream analysis, if you will see tip of the tongue phenomena, if you will say talking theory, if you will talk about catharsis, everything is based on this particular domain. The person who has this type of issues can be suitable for reconstructive psychotherapy. So here also we can deal anxiety disorder, phobia, panic attack, everything we can deal in reconstructive psychotherapy. As we discussed, phobia, conversion disorder, some obsessional compulsive disorder, somatoform disorder, and some personality disorder. I won't go in detail. I think you are aware about this disorder, so we'll not discuss this disorder. Now, after this type of psychotherapy, there is a phases of psychotherapy. First thing you should understand, there is a major three pillar for psychotherapy. Now we are discussing how to make phases of psychotherapy. So there is three major phases of psychotherapy. One is initial phase, which is known as beginning phase, then middle phase, and then end phase or termination phase. All phases have their own different objectives. Like for example, once patient comes to you, how do you deal with this patient? You will say, sir, we basically establish rapport. True. Without rapport establishment, you can't go ahead with the therapy. So working relationship is very important. That is, in other term, is known as therapeutic alliance. So therapeutic alliance basically is the core base of psychotherapy. In any psychotherapy, not only reconstructive psychotherapy or re-educative psychotherapy, but if we talks about other psychotherapy, that is also very important. So therapeutic relationship. Then we talk about middle phase. Middle phase means what? Here we want to make causative relationship between patient's dynamic personality or problem and causation factor. So we want to determine that particular causes relationship or etiological issues, which we deal with middle phase. Then the last phase is when he become in Middle phase is two different domains. For example, early middle phase, late middle phase, when patient showing improvement and showing some insight. Then we talk about end phase, that is known as termination of psychotherapy. In some cases, we make maintenance psychotherapy also. Right? Doesn't mean we terminated the patient, we can't see that patient. No. In some patient, maintenance phase is very, very important. And that maintenance phase is important because we want to decrease the relapse of that particular problem. If we talk about modes of psychotherapy, in which mode we can give psychotherapy. For example, if we talk about assessment, right? We are doing so many assessment, psychological assessment, intelligence assessment, personality assessment, right? Aptitude testing. So few assessment we can do in group, but few assessment we can't do in group. For example, we want to assess somebody's personality through Rorschach psychodiagnostic test. So Rorschach is a test which we can use in a individual manner. That is not suitable for group. But if you want to give some paper pencil test, we can give in a group. The class will do that group assessment and they can submit it to you. For example, class paper. That is also we want to assess this person, overall performance. In same line, psychotherapy can be given by individual mode, group mode, family mode, couple and marital mode. Right? For example, if we talk about family therapy, which you people are more comfortable with that particular psychotherapy, you use family mode only. But if we talk about that family is related to a couple problem only or marital issues, you used to give couple and marital mode. So that's depend. But most of the reconstructive psychotherapy comes in an individual mode. Like we want to say talking cure therapy, or we say psychoanalytical psychotherapy. That is basically useful in individual mode. We can't give in a group mode. Few technique, for example, we talk about group psychotherapy. That basically good in group mode only. For example, we used to make some treatment for OCD clinic. So we used to make that OCD group, and that group is same. We used to follow ERP, hierarchy, JPMR, all technique we can use in group mode. So these modes are very important when we discuss the treatment plan. We want to make treatment plan of the patient. Now, theoretical perspective, that is another important aspect. The when we classified these particular three different domains, the more important we will discuss one by one. For example, historically we are discussing psychoanalytic is very important or very oldest psychotherapy. Then behavior therapy came into existence. Then CBT came into existence, cognitive behavior therapy. Then third wave psychotherapy came. Now fourth wave psychotherapy has been into existence. So different waves has come in the psychotherapy. So psychoanalytical psychodynamic therapy is known as first wave psychotherapy, where we talk about Freudian technique, object relationship technique, Adlerian technique, and Jungian technique. As I told you, the person who was very close to Freud, and they followed all the technique like Freud was following. So that is known as Jungian or analytical psychotherapy technique. So all these three first wave psychotherapy is very important for theoretical perspective. As I told you, that was the base of all psychotherapy. After that, they are bifurcated from their own theory, right? You must be aware about Freud. I won't go in detail. You must be aware about Jung also. Initially, they were very good friends. They developed or they worked hard for few years together. But in 1919, they were different. Their thought of theory was different. So after that, he made his own psychoanalytical technique group, and he was on psychoanalysis group. In psychoanalysis therapy, we are using some terms. For example, transference, counter-transference, therapeutic alliance, resistance, and free association. As we discuss what is transference, psychoanalytical psychotherapy is giving more importance to relationship building of the therapy plus patient. Here, the transference means what? When we, the patient think or patient imagine or patient give the same emotion on the therapist. For example, negative or positive. According to Freud, that transference is very, very important. And transference is unconscious redirection of feelings. Somebody is, has aggression toward his father, and the same aggression is showing towards therapist. That is negative transference. So according to Freud, that is very important. Then counter transference. the vice versa. For example, therapist has some negative or positive feeling towards patient that will become counter-transference. As I told you, therapeutic alliance is very important in psychoanalysis. The relationship between therapist and the patient that basically given indicator of outcome of psychotherapy. Then resistance and free association. In psychoanalysis technique, the major thing which we used to follow is free association, right? Where patient can discuss all the issues freely. The another aspect which is very important in psychoanalysis, that is defense mechanism. Everybody uses this defense mechanism, but somebody is aware about the defense mechanism, somebody is not aware. And maximum defense mechanism is unconscious process. There are few mature defense mechanism, there are some less mature defense mechanism, and these defense mechanism, according to Freud, can give any direction towards psychopathology. For example, if somebody is using maximum time projection, that is a defense mechanism, can lead to psychotic illness. Or if a patient is using more internalized defense mechanism, right? This is my fault. I can't do anything. I was a failure. That basically leads to depression. That is a very common phenomenon. And sublimation is a mature defense mechanism, right? So these are the few defense mechanisms. Like in OCD also, there are defense mechanisms different. For example, reaction formation, rationalization. So they are using different defense mechanisms. The another perspective is behavior therapy. As we discussed, that is based on learning principle. Then after behavior therapy, new technique came that is known as cognitive therapy. Behavior therapy is basically talks about behavior of the person. It means behavioral learning principle that is based on reinforcement, that is based on shaping, that is based on negative reinforcement, that is based on punishment. So that is talking about behavioral learning principle. But cognitive therapy is talking about thinking process. Initially, they were saying depression can be treated by only learning principle. If somebody is sad, it means he has learned that particular behavior. But in cognitive therapy, both aspects is very important: behavior and cognition. It means thought is important and our behavior is very important. And through that behavior and activity, we can change his improvement and we can change his psychopathology. The Gestalt approach is basically part of behavior therapy per se. Initially, that technique has been used, but if we talk about waves of psychotherapy, we less use the Gestalt therapy. Existential humanistic therapy came in between behavior therapy. Like for example, humanistic therapy talks about personality growth. As I told you, if you can recall that the definition of psychotherapy, third was personality growth. It means our personality is basically based on our developmental phases, and how we develop that determine your overall personality. Humanistic theory, right? This we have discussed major therapeutic approach of Sigmund Freud or psychoanalytical psychotherapy. I won't go in much detail. Then behavior therapy, as we discussed, is based on learning only. Maladaptive behavior is basically acquired by learning, and that is basically gives a problem in a current perspective. And the main focus on current behavior. We are not talking about past behavior like we are discussing in psychoanalytical psychotherapy. Reconstructive psychotherapy works on past phenomena, but learning principle based on present phenomena. These are the major difference between these two. Another major difference, if we see reconstructive psychotherapy or Freudian psychotherapy, we can't measure, the treatment goal we can't measure. We can't give the pre-post assessment to the patient. This is very slow, steady, and basically economical cost was very high in psychoanalytical psychotherapy on that time when we talked about Freud. But behavior therapy is vice versa, is a short-term psychotherapy. Like everywhere, if you will see OCD patient or panic attack or anxiety disorder, we talk about CBT, BT or CBT. So it means it has limited time capacity, economically is cheap than psychoanalytical psychotherapy. It focus on current perspective rather than past perspective, right? And different domain technique is used like shaping, chaining, extinction, systematic desensitization, flooding, modeling, token economy. These are the part of behavior psychotherapy. But when we talk about cognitive psychotherapy or cognitive part of CBT, then we talk about thinking, in which we talk about negative thoughts, all or none phenomena, schema, belief, that we talk about cognitive aspect of that particular therapy. Here we are talking about CBT, right? So cognitive plus behavior is known as cognitive behavior psychotherapy. Here we are using some other techniques, cognitive method, for example, to identify cognition, cognitive restructuring, right? Diary maintaining, thought diary maintaining, we used to call it reality testing. That is part of cognitive psychotherapy. And then behavioral management, as I told you, activity scheduling, graded task assignment, thought stopping, distraction. So the CBT is basically combination of two basic parts, cognition plus behavior. Another important aspect, which is known as third wave psychotherapy. We have discussed first wave psychotherapy, that is psychoanalytical perspective. Second wave psychotherapy, that is behavioral psychotherapy. Then CBT came into existence. The third would be, which is nowadays is very, very popular. We have seen or evidence based. The another aspect which you should remember when we discuss the psychotherapy overview, the very important aspect, the evidence based psychotherapy. Why we are not using too much psychoanalysis? Because there is no evidence at all. But in behavior therapy, there are a lot of evidence. If you see meta-analysis, randomized control trial, maximum they are using either CBT or BT. That's why this is more popular. And psychoanalysis is not popular because there is no randomized control trial. There is no meta-analysis has been used. So that's why there is less evidence-based, but in behavior therapy or CBT, that is more evidence-based. Third way, why this popularity is increasing? Because that is more evidence-based. And interestingly, it has two different phenomena. They have clubbed this all the three components. For example, we talk about a little bit constructive psychotherapy, more is behavior therapy, and another is mindfulness therapy. So very famous third wave psychotherapy is ACT, acceptance commitment therapy, DBT, dialectic behavior therapy, and mindfulness technique. So we will discuss, because we want to give an overview to you. I won't go in detail of ACT, DBT. Basically, DBT is very, very, very famous for borderline personality disorder or personality issues. We used to do DBT. ACT basically we can give in depression also, or ACT we can give in a neurotic spectrum disorder. But the key concept or the key component of mindfulness is very important in both the techniques. So I will first discuss mindfulness. The mindfulness is very famous concept is given by Kabat-Zinn in 1994. The very basic phenomena of mindfulness is paying attention in a particular way. That is the crux of mindfulness, right? Three basic important: intention, attention, and attitude. Whatever you are doing, what is your purpose? Intention. Whether you're giving attention to that particular purpose, purposeful attention, and in a which way you are giving. It means attitude. So mindfulness has three basic qualities. And just try to understand this particular quality, which is very important: intention, attention, and attitude. All these three basic domains are basically part of mindfulness. And this lead or affect each other in a bidirectional, right? Intention can affect attitude, attitude can affect intention. The same way, intention can affect attention, and attention can affect intention. So this is the bidirectional view, and these three were the major pillars of mindfulness. So basically, mindfulness, what it basically do, you know? So mindfulness is basically, as the literature is saying, or evidence-based management is saying, is stress reduction technique. It can boost up your working memory. It can enhance your focus. You can be more or less emotionally reactive. For example, if somebody told you something and you suddenly will be impulsive and throwing your mobile on him, it means your activity is too much. Nowadays, if you will see, our life is very, very, full of haphazard things. At one time, you are multitasking. You are listening to this lecture also. Maybe you are taking dinner also. Maybe you are in phone also. Maybe you are checking WhatsApp also. It means this multitasking task is not giving you any particular attention on any particular task. Your attention is bifurcated in so many attention. So mindfulness basically enhance your attention so that you can be mindful, can do any activity, and you will enjoy that particular activity. It can enhance your self insight, right? It can change your fear modulation. So these are the few mindful technique which is very, very important, promotes your individual growth. One basic technique maybe you should remember, that is known as sober. Sober means stop, observe, breath, expand your awareness, and respond. What we basically do in aggression, if some patient will come to you and you will, parents will say, uh, my son or my daughter is very aggressive. What do you do in anger management? Three tasks is very important. Take a deep breath. You must be destructive with that particular event. You just expand your awareness. Whatever you are doing, you should be aware that particular, and what you are responding. That is again another important aspect. So sober is a very perfect task when we talk about mindfulness. Different techniques are there. For example, we're talking about mindfulness breathing, mindfulness eating. So these are the different technique, or breathing exercise, that is also part of mindfulness. That's why we said this third wave psychotherapy is a combination of different approaches: behavior therapy, somewhere constructive psychotherapy, more or less supportive psychotherapy, and this mindfulness also. So combination of so many different elements or phenomena. So this sober is very important aspect of mindfulness. Now, as I told you, we will discuss mindfulness first, then ACT will be in a second direction. Why? Because ACT has both the component. One is behavioral component, in which we talk about behavior, cognitive component, which we talk about different thought process, for example, fusion, diffusion, then mindfulness. It means ACT is a perfect example of behavior therapy plus mindfulness, cognitive behavior therapy plus mindfulness. So these two different domains can be clubbed into together and become ACT. So they talk about value, they talk about the current aspect of an individual, they talk about the mindfulness, they talk about the committed action. So these are the different concepts which basically we follow in ACT. So all this psychotherapy, for example, we start from reconstructive psychotherapy to re-educative psychotherapy to supportive psychotherapy. It has different components according to the patient's issues, according to the patient's problem. We used to select which therapy can be useful. For example, the special population. For example, we talk about geriatric population, or we talk about child population. Doesn't mean the same psychotherapy can work in all the population like together. No, for child population there is a different phenomenon in psychotherapy. In geriatric population there is a different phenomenon in psychotherapy. When you talk about adult psychotherapy, there is a different phenomenon. So that we have to take care about that. So all psychotherapy have their common feature. That is sure. It means therapeutic alliance is a common feature. Either you talk about reconstructive psychotherapy, either you can talk about behavior psychotherapy, or you talk about supportive psychotherapy. There must be some common thread in between these three psychotherapies. Psychotherapy can be effective, but we have to see and we have to think in which variety we want to use psychotherapy. Psychotherapy basically changes the brain activity. Talking cure doesn't mean we are just talking to the patient, nothing is happening. No, there are few changes are there in the brain. Latest study of fMRI, when we see this fMRI study of psychotherapy, they have seen so many changes in your emotional domain, so many changes in your lobe functions, so many changes in your reactivity responses. They have checked out from fMRI studies. Then there is no right or wrong approach in psychotherapy. We can't say this technique is 100% for this particular patient, or this particular personality is suitable for that particular. So there is no all or none phenomenon in psychotherapy. Sometimes multiple patient factors are very important for psychotherapy. And interesting phenomena here, the eclectic approach is very important. As I told you, doesn't mean only psychotherapy. Means if we talk about reconstructive psychotherapy, the patient should be 100% we are giving reconstructive psychotherapy or stable for reconstructive. Sometimes eclectic approach can work in this particular population. So eclectic approach sometimes is very useful, where behavioral psychotherapy, part of behavioral psychotherapy, part of reconstructive psychotherapy can be helpful. So these are the few issues as an overall feature if we talk about psychotherapy we used to discuss. Thank you.